Senator Conway-Walsh, you have 8 minutes.
Thank you, Laska Hirlik, and thank you, Minister, for coming to the House today. I am absolutely disappointed that Minister Harris didn't see fit to be here, even because of the number of people affected by this. Does he not think that 25,000 people were enough to warrant him coming in here? Now, I'm not sure what else he's doing. I'll give him the benefit of the doubt, but I thank you for being here. I also welcome to the gallery today people who have direct experience of this. They know what it's like. They're the people who are going through this pain. And people from Chronic Pain Ireland and Arthritis Ireland and Fibro Ireland and all of the other organisations. And at the outset, I'll say to you, Minister, they're not making it up. They have lots of better things they could be doing today, as we all have. But this is an issue that has caused physical and mental distress to thousands of low-income citizens and their families. And I stress low income. For several weeks now, we have been unsuccessfully trying to get answers to a number of questions. I furnished some of these questions to the Minister in advance of today because I wanted them to be incorporated into the speech that the Minister would make at the beginning. The first of these is, did the HSE make any attempt to negotiate a better price with the manufacturers of Versatis before this decision was taken? Now, I want a yes or I want a no answer to that, and I want details of what was done and how the price was reduced. Was there a full and proper cost-benefit analysis carried out before limiting access to Versatis? And did the Minister consider, the HSE, who were making this decision, consider the extra costs associated with the alternative medication, the hospitalisation, the home help, the home care, the antidepressants, and all of the other costs related to this decision, as well as the numbers of people who would have to reduce their working hours and come out of the workplace because of the pain that they would now be going through. The other question is, how can we say that it's perfectly fine to prescribe Versatis for non-shingle patients for pain relief for those who can pay? How can it be safe for those who can pay? But for those who can't pay, it's not safe. Those who are dependent on medical cards and the drugs payment scheme, I just don't get it. And I want somebody just to clarify that for me. How can for one cohort of patients it be safe and for the other cohort it cannot? And Minister, do you not trust the judgment of the GPs and the medical consultants around this? Do you not think that introducing an additional layer of approval totally undermines the patient, the GP and the consultant relationship? No indication was given to the GPs on how to take patients off this treatment safely. I saw what was given to the GPs, and I want to thank all the GPs and consultants who have contacted us over the months, because this has been going on for several months. I saw it purely related to cost, not about patient safety. In terms of the appeals and the GPs and the consultants, it takes at least 90 minutes to do a proper appeal. And then they have to do it every 3 months now that they're told. The GPs and the consultants cannot see the numbers of people that they need to be seen, never mind to be adding on 90 minutes for 25,000 patients. It just does not make sense whatsoever. Then the Minister will say in terms of the numbers in the UK not using it, but maybe there's a direct correlation between the fact that there are 700,000 people waiting for treatment and for procedures in this country. He needs to look at that. He needs to look at the waiting list for the pain management clinics as well. I'm sorry, Minister. The pain management clinic that is nearest to us, to where I live, is in Galway. We can't even get the right figures. But I can tell you of patients who are waiting at least 2 years and then being told they have to wait another 15 months in order to get into the clinic to get an appointment. These are people in chronic, excruciating pain. The solution to this most distressing situation is possible. That solution has to be lasting and sustainable. That can only happen once the government looks at the issue in a patient-centred and compassionate manner. Minister, at the stroke of a pen today, you or Minister Harris can go back to the HSE and request them to carry out a review of the decision to restrict Versatis for low-income patients. You and Minister Harris can ask them to revert to the pre-December position, whereby those experiencing chronic and unbearable pain can avail of Versatis regardless of their income. Minister, I put it to you that the time spent by very expensive senior HSE personnel would be better spent examining the international research around Versatis that demonstrates the effectiveness of it rather than looking at appeals. That is a pure waste of these people's money.
Well said.
They need to be looking at this research. There is research becoming available all of the time. I really want to thank each and every person who has picked up the phone or took a pen to paper to tell us of their personal experience, to tell us of their pain and their need to continue the only effective treatment available to them. I also want to acknowledge the important part that our national broadcaster, RTE, through the Joe Duffy Show, has played in ensuring that the voices of those suffering the most are heard. And I found it very offensive for the Minister to say that, oh, well, do you expect us to do health policy based on people ringing up a radio show? That was deeply offensive to those people who are suffering as a result of this decision.
He explained that and apologised.
Well, I am sorry, but it doesn't cut it with me, Senator Norris. It doesn't cut it with me to be that flippant about people who are in chronic, excruciating pain. I want to leave the space there. Anybody can make a mistake. Anybody can make a decision, and I know there's huge decisions to be made inside the HSE and health. Anybody can. But surely, when new information comes to light, when the information of the thousands of people who have been contacting us all comes to light, could the Minister not say, well, I will review it and we'll revert to the decision. I'm not looking to hang anybody out to dry. I'm just looking to protect the most vulnerable people in our society from a very genuine place. They don't have options. The options aren't there. I know I'm talking to fibromyalgia patients. The other options aren't there. It's not a case of, well, I can take up another medication that's effective. These people would not be doing that if they weren't in such pain. And for the Minister to say then that the number of appeals, isn't that huge, that amount, that's because many of these people cannot get out of bed to make the appeals. That's because many of these people don't want to burden their doctors. They know that their doctors don't have the 90 minutes that is needed to do this. So I could give you dozens of personal testaments around this. Please, Minister, go back and do the right thing. It is never too late to do the right thing, and the right thing must be done by these patients. Thank you, Minister.